So next on our panel, we have Dr. Simon Awale, and he's about to venture into this world of vaccine manufacturing. Earlier, when I was speaking to him informally, he said that he was about to launch his vaccine manufacturing facility in Nigeria. So I'm sure he'll be sharing some thoughts with us about that. So he is going to paint a picture of what it is like to be managing a manufacturing plant and also business operations, and how he is going to be leveraging the Continental Free Trade Agreement for profitability and growth across African markets. So over to you, Simon.
Thank you very much for the kind introduction and for inviting me to participate in this very important summit. You know, like Chidi and the other previous speakers laid the foundation. What I'm going to do is basically to raise some of the key challenges or pain points that is hampering the production of vaccines on the continent. And then we narrow down on our strategies to overcome this and to make manufacturing vaccines on the continent possible. Now, the key problem or pain points is that there is generally a hesitancy of vaccine manufacturers to engage in technology transfer due to high investment in staff development, equipment procurement, and facility enhancement. This requires investments of tens of millions of dollars to get your staff ready, to procure the equipment that you will need to produce the vaccines, or to enhance the facility that you have. So where would the money come from? You know, so these are the key questions that we need answers to, and the two previous speakers alluded to that as well. The second problem, again, if you want to sustain this manufacturing on the continent, you have to think outside the box, because most of the initiatives that we have today are centered on the finish side of things. And for sustainability, if you want to really sustain vaccine manufacturing, you must start focusing on upstream drug substance manufacturing. So, and this technology transfer should come from experienced manufacturers, people that have done it, and to make it happen. So this technology transfer from experienced manufacturers can help bridge the skill gap by transferring the key technologies and know-how from experienced manufacturers to local manufacturers. And one of the solutions that we're proposing, to solve the finance gap is basically for countries or whatever structure that the African CDC is putting together to create kind of advanced purchase commitment for local manufacturers, so that they will have cheaper funds to make sure that this venture succeeds on the continent. So finally, I will talk about briefly how we collaborated with experienced manufacturers to navigate our path to commercialization of COVID vaccine. Now, for you to set up a vaccine manufacturing facility, and basically that's what we're doing right now. On the continent, you need two things. Number one, you need to identify if you want to develop the drug substance, not just fill finish. You have to identify the technology platform, vaccine platform that you will use. And the second is, to establish collaborations with partners that know how to make that happen. So to do that, we selected, we chose the vaccine platform, which is called the virus-like particle, which is VLP technology, and this platform has been used to use that platform, and it has 15 years safety record. And then the second vaccine that uses this platform is the HPV, human papilloma virus vaccine that protects and prevents cervical cancer. And we know historically that whether 1 dose, 2 dose, 3 doses of these vaccines protects women against cervical cancers up to 10 years, and there's no evidence of decay in the protection. So we chose this platform, first of all, to make Ebola vaccines. There's no time to talk about that, the HIV. Then when Ebola came, it catalyzed the mission. So we decided now to use that platform to make a COVID vaccine, and the current vaccines focus against the Omicron. Now, the beauty of the virus-like particle is that it allows you to mix different variants, in the vaccine. So we decided to make the Beta, the Delta, and now we're working on the Omicron to make it a trivalent famous, one of the sites for trials where we're going to do trials. We expand to Nigeria and then to Ghana. So for the in developing that vaccine, you can use it to move to commercialization. We'll finish the preclinical testing in animals, so we're in the process of doing phase 1 trials. But alongside, for you to build a vaccine factory, you have to develop the process because the facility is going to be designed based on the process that you have developed. Vaccine manufacturing is not generic. Vaccine factory is not like generic where you build something and then you go produce any vaccine. No, the facilities are designed based on the process that you have developed. So we developed a process for the VLP and partnering with Merck, KGA, German company. They are now design was sent to them, and they have designed the facility, and then they are going to build a facility. All of that is a modular facility that will be built out of Europe, and then once it is completed, we just dismantle that and ship to Nigeria, erect it, and then we call it plug and play. Where you start manufacturing. So that process is ongoing, and then the process for the commercialization of the COVID vaccine is ongoing as well here in the US. We make the product 3, of course, trials to be done in South Africa, Ghana, and this. And after that trials is successful, the strategy is to continue to produce the vaccines here in the US until our factory for commercialization, until our factory is up and running. So, for us to be successful to make this happen on the continent, we have to devise different strategies, using different collaborations to make this happen because of the initial capital involvement these things happen. So we're doing, because we're not only looking at vaccines. One of the key things that we have to look at on the continent is how do we continue to provide the surveillance tools to monitor the different diseases that we have on the continent, because it is based on that different interventions are designed. So partnering with Afromedics, we develop bid-based multiplex assays that will enable us to, using just one assay, to be able to detect multiple diseases at the same time. So combining these two and then the vaccine manufacturing capability that we have, we believe that we are in a better position to solve some of the bigger challenges that we have on the continent. So my time is up, and I will be very happy to expatiate on any issue that comes up. Thank you very much for inviting us.
Thank you very much, Simon, for those insights. I see a lot of questions coming through on the chat. So certainly a lot of debate going on there, which we will get to